And we've explained this in our 6 steps that you and I talked the first time we met, right? And it's in our first paper in 2014. So to
And
say
just really quickly, Jazz, can you go over those 6 steps really quick?
that's really important because in our opinion, based on our research, there are 6 specific steps that need to occur in sequence. So they're consecutive steps that lead to the development of cancer. And the first step, as we might all sort of almost instinctively understand, is there needs to be some kind of stimulation, typically a chemical stimulation, as in a chemical that's a carcinogen, a cancer-causing chemical. The most obvious example of that is smoking. So if you smoke, you don't get cancer right away. You get cancer typically 20 to 40 years later after you started smoking. So that's one example of a stimulation that causes an inflammation. And the second type of example might be a virus or a bacteria. So the virus, most obviously, again, is hepatitis C virus, which causes liver cancer. And so you can be exposed to the hep C, as we call it, hep C virus, and not know anything about it, not know that you're exposed. So the first part, this stimulus that we call either chemical or biological, is a very subtle type of change that you don't experience, you don't feel it. There's no symptoms, you don't, get a headache or a pain or swelling or anything that you can recognize. And this stimulus, this chemical or biological stimulus, if it occurs over a long period of time, if it becomes chronic, it leads to inflammation. So which is step 2 in the sequence. So inflammation generally is a good thing. You get a wound or you get a bad cold, a severe cold, a sore throat, you have inflammation. That's called acute inflammation. That gets resolved and you're fine. There's no lingering problem. But in the case of smoking or hepatitis C virus exposure or other chemical or biological exposures, the acute phase becomes chronic, where the inflammation is a low-level inflammation that's going on in your body, again, with no sign or symptoms that you're experiencing this low level of chronic inflammation. And if that inflammation continues and persists for a very long period of time, typically many years, maybe decades, as, for example, in the case of smoking or hepatitis C, then you wind up with fibrosis, which is step 3 of the 6-step sequence. And fibrosis simply in lay terms means scar tissue. So if you cut your finger in the kitchen while cooking, cutting onions, for example, which I've done many times, then the tissue, the scar that forms over the knife wound is fibrosis, but that's good fibrosis because it prevents germs from getting into your body, and over time it just resolves. The fibrosis we are talking about in cancer is a fibrosis that occurs internally, say in breast tissue or liver or lung or wherever. And that fibrosis sort of is like a nest of collagen and elastin fibers that basically creates a home environment or a neighborhood for cancer to develop. And so that's step 3, the fibrosis, very important step. Step 4 is then what's called a precancerous niche. And that precancerous niche is that whole nest that I just mentioned, which is this in a very small localized area of your body, again, you have no symptoms, no knowledge that this is going on. And this nest, again, is a pro-cancer kind of environment. So the neighborhood changes within your body, wherever this is happening, for the worse, obviously. Then step 5 is what we call a chronic stress escape strategy, CSES, which is really the body's attempt to restore normalcy, to bring back health. So the body has all these sensors, just like our cars do nowadays, and it can sense that there's something weird going on in your liver or your lung or wherever this precancerous niche is, and this low-level inflammation. The body tries to heal itself. And that chronic stress escape strategy, step 5, if that succeeds, you're fine, you will never develop cancer. But if that chronic stress escape strategy, step 5, fails, then you wind up with the cells in that small neighborhood becoming cancerous. You get the transition from a normal cell to a cancer cell. And that transformation is step 6.